And on your screen is Congressman Eric Cantor, the Chief Deputy Whip for the Republican Party in the House of Representatives. Mr. Cantor, thanks for being with us.
Good morning.
Well, where does health care debate and the possibility for legislation stand in your eyes right now?
Well, listen, we heard the President last night speak about the need for us all to support some kind of health care reform, and I don't think there's any question that any of us accept the status quo. But we've got to get it right. And the President last night seemed somewhat impatient that we were not necessarily, nor are the American people necessarily embracing his government health care plan. And that's because there's just a lot of questions. There's a lot of questions about what that means for people and what it means for their health care. And what we heard last night was not a lot of details. The President did get into some discussion about the government somehow knowing that doctors are prescribing the wrong remedies and that somehow doing too much, and that we in Washington can do better and say that doctors should be administering other kinds of treatments. So that was, I think, a very alarming statement by the President. But again, I think that all of us need to work together and see if we can make sure that we deliver the health care reform and get it right.
Well, what does getting it right mean?
Well, getting it right means, number one, we've got to, first of all, realize that most Americans do have health care and most Americans like that quality of care. So we've got to maintain that quality, got to increase the ability for the private sector to stay in the game, if you will, which means adding flexibility to the employers out there that do provide health care benefits. Nearly 70% of Americans under 65 get their health care benefits through employers. And so we need to be able to allow those businesses to stay in the game and to reduce costs. Secondly, we've got to do something to make sure that people who lose their job aren't necessarily losing their health care. And we've got to provide the ability and the flexibility in law so that people aren't losing that protection when they lose their job. And lastly, we've got to figure out, finally, how to reduce health care costs. And a big fact that's missing in all of this is the runaway litigation and somehow where doctors are practicing defensive medicine. And there are some estimates that reach $300 billion that we can save if we can institute some type of reform so that we don't have these runaway lawsuits. These are the type of things that need to be discussed. Frankly, were not laid out last night. And that's why I think you're seeing the public opinion polls continue to decline in people's approval of this President's health care plan and increase in their skepticism, saying, wait a minute, we don't necessarily want the direction that we're hearing right now.
Here's a view from a viewer with a very different point of view named Zagastino. It's not about popularity and Obama. It's a life and death struggle for a basic need that our government refuses to grant us. What's your take on that?
Well, listen, first of all, the notion that the President even suggested last night that somehow people are trying to exact political points and that it's all about stopping Obama, I think that's a straw man argument, Zagastino. I think that all of us want to do something to address the problems with the status quo. And we do know that, frankly, there are millions of Americans right now that are facing a health care crisis. When you don't have health care insurance, it is a crisis for you and your family. And that's why we are committed to trying to get it right and make sure that more Americans have access to basic coverage, to make sure that the Americans that have health care that they like can keep it.
For the minority whip of the House of Representatives, next telephone call is from Frederick, Maryland. Richard, Independent Line.
Hello, how are you doing? Thanks for taking my call. Thank God for CSPAN. This health care situation is not going to get fixed because they basically protecting the insurance people. That's all they're doing. Now, even Obama is supposed to change health care for the American people, but you take concessions from the insurance people. These people, they're paying millions of dollars a day in lobbying Congress. They continue to give them money to the campaign fund. All the insurance people and the Congress people using American as a big piggy bank. That's all it is. More than half of your premiums going to somebody's pocket. It's not going for your health care. People are dying every day for lack of health care. They pay people not to cover people with the insurance they pay for. This is a big racket, and this is nothing about the American people. This is continuing the cash cow for the insurance people, for Congress, and for their little write-offs and stuff. This is criminal. You got to take profit out of health care for it to be reformed. Otherwise, is it just a big joke and you're going to continue getting what you're getting right now from Congress?
Thank you. Taking the profit out of health care.
Well, Richard, what we've got to do is emphasize patient choice and the ability for all of us to see the doctors that we want to see and provide the care that the doctors believe is necessary for any type of disease or condition that we may have. And the real question is, how do we facilitate that? And what we heard last night from the President was not a lot of detail as to how he thinks that the government can step in and do it better and bring down costs so that people can have more access. What we do know, however, is the more that patients understand what's involved with the procedure, the more that they understand as far as what options they have are available, the more they can talk to their doctor and allow the doctor to make the decision, the better the quality of care. That's really the direction that we need to head. And, I think that, casting blame on folks who say that, on some, and the President said, I mean, there are some who want to do this and stop this for political reasons. I think we ought to stay away from that. We ought to try and all come together and get this right because it means so much, as you say, to so many Americans. In many instances, it's life or death.
Next question or comment for Mr. Cantor comes from Kendallville, Illinois. This is Ryan on a Republican line. Good morning, Ryan.
Good morning. Thank you for taking my call. It seems like you can never waste a good emergency or a good crisis. That's the new key word. Everything is a crisis. My goodness. My mom grew up in the Depression, and as long as there was a little bit of food on the table and there was some a door to lock so you could go to bed safe at night, everything in America was just fine. We've become into a nanny state, baby society. Oh, there's a crisis for this, there's a crisis for that. And you know who makes the problems? Is your government. You people in government make the problems. You all sit there with your high salaries in your gated little communities, and you look down the funnel of your nose at the average American and treat us like we're fools. Sir, we don't need your government. We don't need your programs and everything else. You know what we need you to do? We need you, and this goes for Republicans and Democrats, all of you are a bunch of crooks. What you've got to do is you got to secure our borders, number one. You got to follow the Fourth Amendment. Number two, you got to keep electricity and utilities and get out of America's way. Get out of the American people's way with all your programs and your therapy for us. We have a nanny state, Obama running the car companies, Obama running the banks. You have $3 million in signs that say Obama stimulus. These are just ruining America, all of you. And where were you Republicans 8 years in power where you wouldn't even secure our borders because of your politically correct nonsense? You want to know why America is disillusioned with you? Is because it doesn't work.
Thank you.
Are overblown.
Thank you, Ryan.
Ryan, I hear your frustration. I tell you, I share the frustration that you got, that Washington can't seem to deliver results. And let me try and address the question about government takeover of so much. And you're right. What we have seen over the last 7 months in Washington is the most extraordinary expansion of government in probably 200 years plus. And as you rightfully suggest, Congress quickly came to session this year and passed almost an $800 billion bill called the stimulus bill, something that all Republicans in the House voted against. And voted against it because we felt it was just more of the same, Washington ways, parochial interest, pork barrel politics, without a lot of results. And as we are in one of the most serious economic situations of our generation, we ought to be very focused on how we get people back to work. That bill did not do that. And that's why we continue to say, let's get it right. Let's take some of those unallocated stimulus dollars, put them to work so that small businesses can start hiring people again. But we see not only the expansion in the spending and the incurring of more debt, we've seen, as you suggest, takeover of the American auto industry by Washington. Now, I think that strikes people in such an extraordinary way as wrong-headed. What does Washington know about running a car company? And I do think that you're right in that sets a terrible precedent, and I am very dissatisfied at the approach that this administration is taking, and frankly many in Congress, in saying that they know best what kind of cars Americans want to drive and how much they should consume as far as gas mileage and how much they should be paying for cars. That's not Washington's game, and we shouldn't be in that. Same goes for health care. You know, the President's delivery last night was just very vague on details. He said that we need to get this done and there should be no excuses. The Republicans in the House continue to say, look, we feel very, very necessary for us to be centered on doctor-patient relationships. We ought to be focused on providing the kind of choice and access that Americans who have health care and like it, and spread that access to more people. We only do that by bringing down costs. Government cannot bring down costs. Neither party has demonstrated the ability to do that unless you start to ration care and take care away from seniors and others.
Our guest was elected to Congress in 2000 for the first time. He served 9 years in Virginia's House of Delegates. He has his bachelor's degree from George Washington, law degree from William & Mary, and master's from Columbia University in New York in what?
In real estate.
And he serves the 7th District of the state of Virginia, which is the area around Culpeper, Virginia. Our next telephone call, actually, I'm going to use it.
It's actually around Richmond and Culpeper.
All right, we'll get Richmond in there too. State capital, important to do. Let me have you hear the Twitter comments of Sasha 2000. Sasha, who writes, Canada is upset with the Republicans. The World Health Organization rates Canada one of the best systems. Why do the Republicans criticize Canada?
Well, you know, it's, Susan, today, actually, the Republican Health Care Solutions Working Group is going to be holding a forum at noon on exactly this question of how outcomes are different in systems like Canada and systems like the UK. And we're going to have some discussion from experts who understand the system and the impact on people in those systems. And the anecdotal evidence as well as the evidence itself, I think, shows that people who are sick with certain types of conditions have to wait an extraordinarily long time to get in for treatment and to get in for procedures. You know, God forbid you are stricken with breast cancer in these systems, in the UK in particular. And if you are in that government plan, there is a very good likelihood that you will wait 3 to 6 months to start your treatment, your chemotherapy treatment. And in many instances, Susan, we know that that is too long and it may be too late. Again, Americans have become used to a level of quality of care that, frankly, they don't want to lose. And by insisting that the government should be the one deciding on that type of care is a very scary thought, and that's why we need a lot more attention given to how we preserve the quality that we do have.
C-SPAN will have cameras in that discussion. It'll be streamed live on cspan.org and then put on our television schedule later as all the congressional events from the House and Senate floor conclude. Next phone call for Congressman Cantor is from Alexandria, Virginia. This is Stone on our Democrats line. Good morning.
Yes, you know, what really saddens me is the pathetic lunacy of this whole health care debate. It has nothing to do with partisanship or party affiliation as far as I'm concerned when it comes to saving people's lives. But let me tell you, let's listen to the truth. This thing is going to fail. It's going to fail miserably. And let me tell you why. You obstructionist politicians in the healthcare industry, the big banks, the lobbyists, you think tanks and elite groups, you've all got this thing sold up. So we may as well go home and forget about it. And I don't see how a lot of you can even look at yourselves in the mirror or go home to your homes at night and look at your children in the face and with a straight face. I don't care if you're a blue dog, a hot dog, a corn dog, or rude dog. This obstructionist politician mess is going to be the destruction of this nation. And also, you also must remember that the Republican Party, the Democratic Party, has done nothing realistically since I can remember. And I can think about Dr. Charles Drew, who was a pioneer in the perfection of blood plasma, an African-American physician who was down south and got in a car accident, and because the color of his skin was denied health care. I can only imagine what he would think today and some of the pioneers of yesteryear who did all they could to help this cause, and they're in their graves waiting to be resurrected. And we're still going on with this nonsense.
Stone, thank you.
Stone, listen, I hear your frustration. Your frustration is focused on Washington's inaction, Washington's inability to deliver results. And I think that is central to the discussion about government takeover of our healthcare system. And again, if you listen to the President last night, there are a lot of questions unanswered about his plan as to how the government is going to be better at delivering health care to the tens of millions of Americans that already have health care, hundreds of millions of Americans that have health care, and to those tens of millions who don't. And you know, it is really, I think, very important that we get this thing right. And what we do in getting it right, I think, is look to expanding choice, look to putting people and their doctors back in charge of the type of health care that they have. And that's really the focus of what the Republican plan is about, and making sure that we join together with like-minded Democrats, frankly, who don't like to see a government takeover of health care. The reason why this plan, as you suggest, is going to fail is that there is a bipartisan majority against the Obama health care plan, because people in this country are very uncomfortable with the notion that somehow Washington is going to be able to tell doctors what they can and can't do. People are uncomfortable with the notion that somehow Washington is going to be able to make a decision as to who can and cannot have access to care. That's not the American way. That's not what families want.
This Twitter comment goes back to quality, and it says, if these people have such long wait lines, this would be the Canadians, why are we ranked 24th in life expectancy in healthy life expectancy by the World Health Organization?
I would say I don't know what the criteria was that the World Health Organization used to rank our system, but I do know that we have proven that if we can promote healthy behavior and habits, we can prolong life expectancy. We can prolong the quality of anyone's life. And that is one of the tenets of the Republican plan, and that is we should be adding flexibility to businesses that provide health care so that they can promote healthier living on the part of their employees. Not only does that extend life, not only does that increase quality, it also reduces costs.
Portland, Maine is next. This is Dwayne on the Independent line. Good morning, Dwayne.
Hi. I'm a little distressed at your lineup this morning so far. I mean, are you planning on having anybody who's an advocate of health care reform on the program? Because, you know, listening to the first guy you had on, then this litany that I'm hearing from Cantor about, this is all Frank Lunt's pre-approved focus group terminology, and it's not true. He's lying to the whole country. 76% of Americans are for public health insurance option. 76% of Americans. We're the 37th country in the world in terms of health care. We have the highest infant mortality rate in the industrialized world. Mr. Cantor has a perfect health care plan for himself and for the rest of Congress. I want to know, if government is so bad at providing health care reform, will Mr. Cantor give up his health care? Or will he, and if not, if he will not give up his health care coverage, and the health care coverage that all of Congress has, which is government-run, why isn't he for extending that coverage to the rest of the American people? I'm tired of hearing these politicians who are on the take from the insurance industry, who are accepting, and I'd like to ask, there's one more question I have for you, Mr. Cantor. I want to know, could you please give us the figure? How much money have you taken from the insurance industry to kill health care reform in this country?
Dwayne, thank you. We understand.
Dwayne, first of all, no one wants to kill health care reform. I said from the get-go that all of us on the Republican side of the aisle, as well as the Democrats, want to see the status quo changed. We've got to change the status quo. As far as the government health care program that the federal employees are on, yes, you're absolutely right. We should be providing access to that type of coverage for as many Americans as we possibly can. But the real question is, the government health care proposal that's on the table by the Obama administration and the president doesn't do that. What it says is, the premise is, we're going to somehow bring down health care costs by this proposal. The government can't bring down health care costs other than, number one, cutting back on what it pays doctors, or number two, cutting back on the type of treatments available, which means you won't be able to get what you're getting now in terms of the delivery of care, or number three, cutting back in terms of the price of medicine and others. Money just doesn't come out of anywhere, especially if you're going to expand coverage to the uninsured in this country. So what we need to do is we need to look in our system right now as to what works. What we know works is when you have small businesses out there providing health care coverage, struggling up under the rising costs, and trying to address that by keeping costs low, and have demonstrated they can do that, and these are small and large businesses, we ought to take the lead from them. And what it is trying to promote good behavior. What it is reward those who lead a healthier lifestyle, putting flexibility into the system like that. We also need to make sure that people who lose their job don't necessarily lose the protection that they have in their insurance. That's why we've got to provide that flexibility at law to make sure that happens. Then we got to pay for it all. And that's where the President's plan, number one, defies the promise that he made that he won't impose taxes on people making less than $200,000 a year, because it's going to apply to everybody. You know, we have seen that in the markup that has occurred in some of the committees in the House, certainly in the Ways and Means Committee, where you have people now who are able to use their health savings account money and flexible spending account money to buy over-the-counter drugs. Those people are the ones making less than $50,000 a year. And this Obama plan takes the ability for them to use that tax-free money to purchase over-the-counter drugs. You know, but more than that, how do you pay for this? Well, the President says we pay for it by putting a payroll tax on small business. That's not what we should be doing. We've got probably one of the worst economic situations in a generation.
You say pay for it by a payroll tax on small business. It's actually, proposals I've seen contain a tax on income for high-income earners.
Well, Susan, it's both. It is, number one, a surtax that you're speaking of, which applies to people making over $200,000 a year. And if you look at that, 50% of those people are small businesses. But number two, it also requires, the Obama plan, that employers pay an 8% payroll tax if they're not offering a benefit plan which is somehow acceptable to an unelected board here in Washington. So regardless of what the small business can afford, there is going to be an imperative and imposition of a tax. And this starts with small businesses that have payrolls at $400,000 and up. So you're talking about businesses with 6 to 9 employees. And frankly, they're struggling right now just to keep the lights on.
We have about 5 more minutes left with Representative Eric Cantor, who is the minority whip in the House. Next call for him is Frederick, Maryland. This is Jay, Republican line.
Hi.
Good morning.
One of the basic rules of economics is that when you have an inelastic demand, you will not reduce price unless you increase supply. And I guess my question is, why not spend money increasing the number of health care providers, do it through the U.S. Health Service, and have the U.S. Health Service provide care to the uninsured and those that can't otherwise afford health care? You would take them out of the system as a not paying at the hospitals and the doctors, and therefore reduce the cost for those people who have insurance. And you'd increase the supply of health care providers, which ideally would reduce the price.
Well, Jay, first of all, it's interesting discussion on economics, but I think that probably the response to that would be you don't want to have a differentiation in the level of quality of care provided to those who can't afford it on their own and somehow are in a government system. We want everyone to have access to the same type of quality of care. And that's why we have to look at, what's wrong with the system now and try and address what's wrong with the system without throwing out what works. Right now, the government has a system, and the government, as you know, is the largest payor in health care in our system. And we've got government programs which essentially are price-fixing programs. The best doctors get paid the same as the worst, and same for the hospitals. We need to change that. We need to be rewarding, merit-based performance in terms of health care. We ought not just look at quantity. We ought to reward quality. And if we can do that, and if we can address the way that the government programs reward and pay providers, maybe we can stem the loss of people and physicians out there who are making decisions not to continue practice and not to continue to accept government patients because of how confused the system is. So, going back to what the President's talked about last night, there's a lot of discomfort out there right now about health care reform. And I think we need to focus on the details. We need to get this thing right. It is too important to too many families that we maintain the quality that they're used to, at the same time try and bring down costs.
Next call, Prospect, Kentucky. Cynthia, Democrats line.
Yes, good morning, Susan.
Good morning.
Good morning.
Mr. Cantor, I I think all the Republicans that are so against this should turn down Medicare when they become eligible. Also, number two, you're paying $300 for your health care, and the government is subsidizing, our taxpayer money is subsidizing $600 of your health care costs, according to a Republican yesterday. The other thing I wanted to bring up is here in Louisville, we're having a big crisis. Blue Cross Blue Shield and our largest hospital chain are into a big to-do. They couldn't reach an agreement over money, of course. And patients who were scheduled for surgery are unable to get it. We have people with long-term relationships with their doctors who are having to change because Blue Cross won't cover them. So how could this system be any worse than it is now? And also, you failed to answer how much of the $1 million a day that the insurance companies are spending on lobbying against this are you receiving personally. You've been asked that and you refuse to answer. So give us a dollar amount, please. And
Okay. Cynthia, first of all, you asked how could the system be any worse in the situation you have ongoing in Louisville. If you watch C-SPAN when they run this recording of the health care forum that we're going to have today on Capitol Hill, I think you'll get some of the answers. If we go in the direction that Britain has gone or Canada, I think you will then see how much worse off that Americans can be. And that's what we don't want. We want to preserve the ability for people to have access to quality care. As far as your question about, whether the folks here in Washington under the federal employee plan and why is our plan not good, why shouldn't the rest of us have it, I think you're exactly right. Everyone should have access to quality care. In fact, Republicans have continued to say, we've offered amendments in the committees here to say that all of us should be under this option if it's so good. But that's exactly the point. What we know works is innovation out there in the private sector comes when you afford small businesses the flexibility to provide the kind of coverage for their employees that the employees and they know can best fit their budgets and can best fit their families' needs.
Would you like to answer the financing question?
Well, I have no idea. I mean, again, this notion that somehow the insurance lobby is controlling things here. I have seen the insurance lobby been very close to the Obama administration right now in trying to promote a plan that they're putting forward. And in fact, I've had a lot of differences with some of the insurance companies and some of them and their support of what the president's been saying. We don't know what the details are to this plan. What I don't want to see is an end to the type of quality that most Americans have become used to. We want to spread that quality around. We want to go and provide some more flexibility in insurance coverage so that people can be protected if they lose their job.
Mr. Cantor, how do you see this playing out?
Well, listen, I think we're at a crossroads, Susan, in healthcare reform here. Obviously, the American people are becoming increasingly skeptical of the Obama healthcare plan. They're becoming less comfortable with this notion that we should have government in Washington take over their healthcare. And so if we are going to get something done, we all need to work together to understand what works in our system, preserve what works. Again, what works is when you have people able to choose their doctor and choose the type of treatment that they want, not have somebody here in Washington determine that for us, and then try and address the cost situation. The cost situation has a lot to do with liability reform. Never have we heard the president even fulfill his promise when he has said originally that he was going to be for some type of reduction in the lawsuits that continue to come at the medical and healthcare community that add, in some estimates, $300 billion. So we've got to be very, very attentive to the cost issue, and that's a big one that's being left off the table. And then lastly, we've got to be paying attention to the priority, which is to get people back to work in this country. And since most people get their health care through their job, I think that most families right now would want to say, hey, let's focus on economic security, and we can have more health care coverage if more people get back to work.
Thank you very much for being here this morning.
Thank you.